Hi, YouTube. This is Jared Routson. I'm posting this video on my larger YouTube channel. I just want to enter in some notes about what was put on the, what you can find at m.jpost.com. That's mjpost.com. It's the Jerusalem Post is the periodical. And it's about health and science. And it's entitled Hadassah, Hadassah, doctors crack the cause of fatal corona blood clots by Maayan Jaffe-Hoffman, Maayan Jaffe, Hoffman, June 16th, 2020. Hadassah researchers discovered that patients who formed fatal blood clots have an increased level of alpha defensin, that's defensin, of alpha defensin protein in their blood. A research team at Hadassah University Medical Center in Jerusalem's Kerem has discovered what they believe causes coronavirus patients to become seriously ill and even die. They also say they have a way to treat the cause before it's too late. At least 30% of patients with coronavirus develop blood clots that block the flow of blood to their kidneys, heart, and brain, as well as the lungs, according to international research. And there's even some more articles on here that you can go into. Hadassah researchers discovered that the patients who form these fatal clots have an increased level of alpha defensive protein in their blood, explained Dr. Abd Alrauf Higavi, Higavi, who directs a lab at Hadassah and has been studying blood clots for 30 years. Patients with mild symptoms have a low concentration of alpha defensin, he said. Patients with strong disease symptoms have high levels. The patients who die have very high levels. The Hadassah team studied more than 700 blood samples from 80 patients who were admitted to the medical center during the first peak of the corona outbreak in Israel, the coronavirus outbreak in Israel. The results show that alpha defensin speeds up clot formation, which can cause pulmonary embolism, heart attacks, and stroke. In addition, when blood clots form in the alveoli, whose function is to exchange oxygen and carbon dioxide molecules to and from the bloodstream, this can lead to respiratory distress and eventually intubation. Multiple studies have shown that around 80% of coronavirus patients who are intubated have died. Higavi said his team are en route to a solution, administering the drug Colchicine to coronavirus patients. That's spelled Colchicine. Colchicine to coronavirus patients. Colchicine is an approved drug used in the prevention and treatment of gout attacks caused by too much uric acid in the blood. Higavi said they have completed testing colchicine on mice and found that it successfully inhibited the release of alpha defensin. Now they are waiting for the necessary approvals to test it on human coronavirus patients. The researchers said that clinical trials would look at use of the drug both for severe cases and administering it to patients with mild or moderate symptoms to see if it will help decrease the chances of their developing a severe case of the disease. The drugs available today in the blood thinning market do not fully address this clotting, since its mechanism differs from the mechanisms for which these drugs currently exist, Higavi said. Resources should be diverted to find a suitable drug for coronavirus patients. And that was the Jerusalem Post. So I guess they're trying to get approval for this drug by testing it in humans. And they need to get approval to get it tested in humans now that they've found it successful to block that enzyme or that blood protein in mice. So this just goes right along with what I've been said on my last YouTube video about how Italian doctors did autopsies on people who died of corona, and they found their blood vessels dilated and filled with thrombosis, blood clots, all throughout their bodies and in their lungs, heart, and brain. So apparently 30% of these patients, according to this article here, are going to have severe blood clots because of coronavirus. So I'm just passing that on, and hold on. My apologies, I'm doing this spur of the moment video. Remember in the last article I said that thrombosis was being caused by disseminated intravascular coagulation, and they found that it was a bacteria. Coronavirus, or COVID-19, is a bacteria. And they're now changing their treatment approach, according to this article, with antibiotics, anti-inflammatories, and anticoagulants. And they're finding that 5G increases the inflammation and the hypoxia in these sufferers. And that article that I previously cited is at Italia Revela Curare del COVID-19. That's spelled at ITALIAREVELACURARDEL COVID, that's spelled COVID-19. That's one word. That's according to the Italy Ministry of Health. A new drug they're looking at for coronavirus is called dexamethasone, or DETHAMEXADONE. I think it's because it's cheap and it's anti-inflammatory. So whatever this corona bacteria is doing, it's releasing toxins or something to inflammate the blood. The blood reacts by this protein in people by producing the disseminated intravascular coagulation, where some of your blood becomes, it's a medical term, look it up. There's a lot of symptoms that the web search will reveal about how you know you have this. What are the symptoms of disseminated intravascular coagulation? There's a lot of symptoms on it. Some of them include, well, I'm not even going to go into it because I'm not a doctor. But it's this protein in the blood, alpha defensin, that coronavirus cause these thrombosis. And autopsy patients were found to have the thromboses all throughout their dilated bodies, their arteries dilated with these thromboses. So that's all I wanted to get on and say. I hope they rush this drug. colchicine and get it approved because it's used in the prevention and treatment of gout attacks caused by too much uric acid in the blood, according to the article. And I thank the person who sent me this Facebook article, and thank you for listening.